Hello, it's John Kanelopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center, clinical professor of ophthalmology at NYU Medical School in New York City, New York. And these pictures that we saw should be immediately recognizable by any ophthalmologist, even in their first year of training. This is classic retinitis pigmentosa, gives a classic bone spicule appearance in these wide field retina images. We're looking at the retina, which is the back part of the eye. It's the part of the eye that the eye works to focus images on the macula at night throughout the peripheral retina. The central retina is pretty good. That's why this patient has symptoms mainly at night. He has very poor vision at night because at night the rods, which are the periphery sensory cells of the retina, take over from the cones, which are central and are used mainly in day and bright light and also to make out colors. So this is a mainly rod retinitis pigmentosa. We can see the classic waxy appearance of the optic nerve, attenuation of the retinal vessels, and for an experienced ophthalmologist, we can see the clouding of what would have been in front of the macula, which depicts posterior subcapsular cataract. So there's cataract formation here as well. This is a eye-master view of his lenses. They're quite fuzzy and very thick, 4.8 millimeters. This is what a normal lens looks like, 3.2 millimeters in thickness and quite lucent to light. So things to pay attention in retinitis pigmentosa, which I'm sure we'll be able to cure in the years to come with something similar to the COVID vaccine, the COVID mRNA vaccines. The healthy patch of damaged DNA will be able to enter the body and fix this problem. 4 things. Cystoid macular edema, we saw it, this patient doesn't have it. Cataract formation, we saw it, this patient does have it and he will benefit from cataract surgery. Maximum vitamin A supplementation, dietary supplementation. And number 4, blue-free lights, UV and blue-free lights, because blue light is very toxic for these neurosensory cells, and people who reach this point are not as sensitive to light as the normal people are, so their pupil dilates, they can tolerate more bright light, sunlight, which is very toxic on the retina, and that's a vicious cycle for them getting more damage. So a few basic things on retinitis pigmentosa. I retook my boards this last week for the 3rd time. Very proud that I passed them, and these are some of the basic things we should know. And coming from a cornea specialist, it carries, I think, a little bit more weight. Thanks so much for watching.